I do have a couple of topics to cover. And Commissioner Schwinn is joining me today. She's got a brief topic to cover as well, and then she and I will both be available for questions as long as time allows. So the first thing I want to bring you is some really good news that Tennesseans are responding to the COVID-19 vaccine. You know, it's August is National Immunization Awareness Month, and Tennesseans, for whatever reason, whether it's that, whether it's overcoming their hesitancy, Tennesseans are responding to getting vaccinated. That's really encouraging. Of all of our doses of COVID-19, both first dose and second dose, are up 57% in the last 3 weeks. But what's even more exciting, and you may have seen it come out of the White House yesterday, White House recognized Tennessee for having a 90% increase in first doses over the last 2 weeks. That is very encouraging to me and should be encouraging to you as well. You know, our supply chain is very steady. It is widely accessible and widely available. I can't even imagine there being a wait much of anywhere. Most places have a walk-in, or if it's more convenient, an appointment system. But vaccine is widely available and accessible, and Tennesseans are accessing it. That's very encouraging news, and I was glad to hear that. You know, that's something else that differentiates us from where we found ourselves back in the winter. And I've heard that a lot lately, comparing this surge that we are in, and we are in a surge right now, compared to that of the wintertime. And while some of the epidemic curves may be similar, we are vastly different in what we are able to do right now. We have a tool now, and that is vaccine. We had some okay tools back in the winter. None of them were great, but we have the single best tool now, and it is vaccine. And if you're in that category that hasn't yet gotten a vaccine, I don't want you to think that it's too late. I'm starting to hear a little bit of rhetoric that, well, the surge is here, and by the time I get the shot and have my 2 weeks out, it's going to be too late. That's absolutely untrue. You should get it today. If you want to get it, don't worry about it being too late. Go ahead and pursue that opportunity now. Our vaccines are extremely effective against serious illness and death. You've heard me quote this statistic before. Over 90% of our hospitalizations and 95% of our deaths are in the unvaccinated. And so our vaccine's very effective. It's very available. I encourage you to do that today if you haven't done so already. Now, let me go to a little bit more serious note, which is some increases that we are seeing in certain populations of COVID, and I'm going to tell you what we're going to do about that. So, our pediatric cases are quickly on the rise. And to give you a little bit of perspective, in about the middle of July, so the week of July 18th, we had 1,800 cases in kids. The very next week, the week of July 25th, we had 3,200 cases. So almost a doubling in a week. And then, you know, our data is a few days behind. And so we'll soon have the next week, but I expect it to be up pretty much in the same manner. In some ways, that's not surprising because that's what our peer states are seeing. You know, a lot of this started in Missouri and Arkansas, but some of our other nearby states, Louisiana and Florida specifically, but most states in the South are seeing this big resurgence. And likewise, they are also seeing an increasing proportion of kids getting infected. It's very important that we talk about why that is, because there's a widespread narrative that the Delta variant preferentially infects kids or that it makes kids sicker. That's just simply not true. I'll tell you what is true about the Delta variant. It is much more contagious. Sometimes we call that transmissible. And to give you a frame of reference, old COVID, if you want to call it that, which was probably the Alpha variant, it's what caused the surge back in the wintertime. That had an infectivity rate, or sometimes we call that an R naught, of between 1 and 2, which means every infected person might infect 1 or 2 other people. Compare that to the Delta variant, which could be around 5. That could be 2 or 3 times more contagious than the COVID that we dealt with back in the wintertime. So it spreads a lot more quickly, and therefore it's a lot more contagious. That's the difference. We don't have any evidence that it makes people sicker. We don't have any evidence that it preferentially infects kids. What we do have evidence of is that all COVID viruses, coronaviruses, infect unvaccinated people more often. Well, who is our largest population of unvaccinated people? It's kids, because the vaccine is only approved down to age 12, and we've had relatively low uptake in teenagers, although that is also improving. And that's some good news. Some of that increase that I mentioned to you earlier is in the adolescent population, which is very encouraging. So I don't want you to confuse correlation and causation between what the Delta variant is and is not in kids. Let me tell you something else that may be confusing to you, or quite frankly, it's probably just more unexpected than it is confusing. And that is the capacity concerns that we're currently having at our children's hospitals. I think what people are doing are hearing this rise in pediatric cases and this capacity concern in children's hospitals and linking those two, and they're not directly linked, at least not right now. Let me tell you what I mean by that. We're also seeing respiratory illnesses this summer in July and August that we've never seen in the summertime before, or never seen at scale. We usually see them in the dead of winter. Specifically, a virus called respiratory syncytial virus, which is oftentimes called RSV, is a virus that infects young children, usually kids under 2, and it causes a lot of wheezing and respiratory distress. And those kids oftentimes have to go to the hospital and need treatment for that. That is a wintertime illness, but because we never saw that surge last winter, now that kids are getting back together, families and babies are getting out and about, we're starting to see that surge in kids. And very interestingly, the epicurve, or the epidemic curve of RSV, looks almost identical to that in COVID in kids, except it started 2 or 3 weeks earlier. So children's hospitals started filling up in early July with RSV, as well as other respiratory illnesses like parainfluenza, influenza, and other things that we typically don't see in the summertime. Then you have all of your normal summertime admissions, specifically trauma and other type common summertime admissions. And then there's one more factor, and that factor is workforce. And I know you've heard me say many, many times that that physical space is almost never the issue. It's staffed beds. Well, I hate to say it, but healthcare is not immune to all of the workforce strain that our entire society is seeing right now. Just like restaurants and retail stores are having trouble staffing, so are hospitals. So when you combine the unusually high amount of non-summertime infections with the normal summertime admissions that children's hospitals typically have, plus a shortage in staff, you really have a situation where you have capacity concerns. I'll also tell you, this is not different than adult hospitals. You know, our adult hospitals are starting to fill up for all of those very same reasons, but they were also full back in adult hospitals, maybe even starting in June and then into July. So when you add COVID hospitalizations on top of that, that's just enough to tip the scales sometimes. To put that in perspective, we are not having droves and droves of pediatric hospitalizations from COVID, because I told you it's not any more severe than the Alpha variant that we dealt with. But we are having an increase just because we're having an increase in overall cases. And that little increase in COVID cases is what is putting additional strain on children's hospitals that were almost full to begin with. So I want to tell you what we are rolling out today because of that. Before I tell you that, I want to tell you something that may surprise you. It may surprise you that, pediatric hospitals don't typically have capacity concerns. This is something that is new for them, and therefore we don't have a full set of utilization or capacity data like we do with adult hospitals, because as I mentioned, it's really never been an issue before. So one of the things that we're doing today is we're communicating with all of the hospitals in Tennessee and asking them to begin entering their pediatric hospital utilization data, just as we did for adult hospitals last April or May or so. And a lot of them are doing that already, but we are encouraging them to do that on a daily basis now. And then we will use that information to populate a dashboard of pediatric hospital availability, and we'll be able to publish that in the next several days, just as you're used to seeing with our adult hospitals. The other thing we're doing is we're going to be posting additional information on our website related to pediatric cases and pediatric hospitalizations. Beginning today, you will see the inpatient and ICU curves like we've always been doing for adults. I believe yesterday's number was a total of 27 pediatric hospitalizations, 10 of which were in the ICU. So we will now publish those two curves, and that will mirror the adult curves that you're used to seeing. And so you can find that on our website. I've told you about the bed availability dashboard that's coming in the next several days. But then also today, we are changing the frequency as well as the included data in our child dashboard. We have been producing what we call the child dashboard on a monthly basis, kind of gives a big picture of the breakdown of all cases ages 0 to 18. It tells us, are these more infants? Are they more teenagers? Which part of the state are they in? And all of the different variables related to infections in kids. So we are moving that from monthly to weekly, and we're adding additional information on pediatric hospitalization. So it will start breaking that down more granularly, as well as we're adding information on the MIS-C, which is the inflammatory condition that kids sometimes get after having a COVID infection. So I wanted to tell you all that to say we're watching it very closely because we are concerned at those pediatric numbers rising quickly. Although I can't say I'm terribly surprised because that's what our peer states are seeing, and I don't really have any indication that it's going to be a whole lot different here. As you've heard me mention before, a lot of our pediatric cases are in the West Tennessee region right now because of its proximity to Missouri and Arkansas. But as we've seen throughout, now in our fourth surge, this is probably going to be across the state in the next few weeks. So I just wanted to let you know the department is responding by providing more information so not only parents and physicians, but schools and everybody else can make the best decisions based on the latest data that we have. So speaking of schools, I will turn it over to Commissioner Schwinn to talk about some things that are going to be happening in the coming days.
Thank you, Lisa, and appreciate that information. I have just a couple of comments and then certainly remain open for questions. But generally speaking, I wanted to make sure to communicate that we are going to start asking districts to provide information as they did last year. Part of what we'll be doing over the weekend is getting some more solidification on what those specific data elements are. But given the information that Dr. Piercy just shared, it's going to be important first and foremost, that we provide information to parents. Parents deserve to have that level of data about what's happening in their schools and classrooms so they can make the best decision for their own children. Our goal is to provide parents with as much information as possible to make those informed decisions. And so early next week, guidance will be going out to districts regarding the information that they should, again, provide to the department and certainly to families. And we will be happy to provide a copy of that when it goes out. Our goal right now is to have a safe in-person school year. Certainly this week we've talked a lot about our TCAP data and our statewide data and where we are as it relates to academic achievement. And so balancing that urgency that we have to ensure every child has access to a high quality education while ensuring that we have a safe in-person school year this year, though that's the primary focus of the department, and we are very glad to be working so closely with the Department of Health to ensure that both of those goals can be met. With that, I will turn it back over to Dr. Piercy in case there are questions.
Thank you, Sarah. I'll facilitate those.
Yes, ma'am. We will take questions now. The first question is for Brett Kelman with the Tennessean. Brett, please unmute your microphone and address your question to either commissioner.
Good afternoon, everyone. Dr. Piercy, it's been a long time since my brain thought about anything besides coronavirus, but I want to ask a little bit about RSV. One, what would be the best source of data to show the rise in cases? Would that come from the CDC or the Tennessee Department of Health? Is that available online now? And then secondly, what's the interplay between coronavirus and RSV? Is this happening now because of the virus or sheer coincidence? I mean, is this similar to last year when we were worried about having a flu epidemic on top of a coronavirus pandemic? Like, how do these diseases relate to each other?
Yeah, those are great questions, Brett. I appreciate that. So to answer your first question about RSV data, this is something that on the state level, we typically don't track, but the CDC does. Right now, as far as what I could find online, the CDC provides that by region. So they have we're in region 4, which is the Atlanta-based region. You can find that epidemic curve on the CDC's website. I was just looking at it yesterday. And what you will see when you look at that is in plus or minus early July, a very steep uptick in those, and it has somewhat plateaued, but it has plateaued high. Now, you raise a very interesting question about the interplay between RSV and pediatric COVID. And this is the exact conversation that I have been having with children's hospital CEOs every day this week. And some of them are coming in with RSV type symptoms and testing positive for COVID. Some of them are coming in vice versa, COVID symptoms and testing positive for RSV. A lot of times, to be honest, the symptoms are similar, particularly in infants. And so it's hard to figure out which one is causing more disease or, the predominant form of disease. At the end of the day, the children's hospitals are going to take care of them and treat them however they need. But that's a very interesting intersection there. One final comment is, if you think about it, and one of the children's hospital CEOs pointed this out to me, and I thought it was fascinating that her theory was, the children who are under 2 right now are relatively germ naive. So if they were born in the fall or winter of 2019 or 2020, they were likely protected for the first several months of their life because they were newborn, it was holidays, wintertime, and then they entered into the lockdowns of the pandemic. So you have kids that for the first year or year and a half of their lives weren't exposed to really any germs. And so their immune system wasn't really primed to fight anything off. So these are interesting theories that our pediatric scientists are studying, but there is a big interplay right now between RSV and COVID.
Thank you.
Okay, next question is to Jessica Jaglois at WMC. Jessica? Jessica, if you're speaking, we can't hear you. I'm gonna give you one more second. Okay, we will move on to Caleb Perhne. Caleb?
Yeah, I had a question for Commissioner Schwinn about, with what we're seeing with pediatric cases up here in Northeast Tennessee. We've got 2 teenagers on ventilators right now. We're hearing of, some deaths. In light of that, and House Speaker Sexton's comments about mask requirements the other day, will school systems be allowed to follow the CDC guidelines and require masks without worrying about, some sort of retribution? What's the situation there?
Yeah, so appreciate the question. So at this time, nothing's changed in that it is a local decision, and we believe that local communities and families can make the best decisions for their children. And so we would defer to the local community on that decision.
Okay, moving on to BBroders. Brad, please unmute your mic.
Thank you. Thanks for taking my call today, my questions. A question to Dr. Piercy and Dr. Schwinn. I don't know if you saw this morning, Shelby County has now mandated masks for all school districts in Shelby County. I would like to maybe get your reaction to that mask mandate in all schools and daycares and preschools. Your thoughts about how that might hopefully combat the hospitalizations and cases in children in Shelby County. And are you concerned that children's hospitals could be full? Is there a estimation on that? Thank you.
Mr. Schwinn, you want to take the first one? I'll take the second one.
Sure, happy to. And so I think what you're seeing is, I did see that this morning, and I think that's a testament to our districts have already responded. Our districts within the Shelby County area, both Memphis, Shelby County, as well as municipalities have put out statements saying that they will follow the directive of that local health department and start requiring masks on Monday. So again, we would defer to the local decision-making process, but certainly I do want to make sure to highlight that our superintendents absolutely will ensure that they do everything possible, both to serve their children academically, to make sure their children are safe, and to follow any guidance or requirements as outlined for them.
And related to your question about pediatric hospitals and their capacity concerns, I'll remind you, they were full before, or nearing to be full before COVID hit kids in early July. And so the extra COVID burden of children being hospitalized with COVID is likely just enough to tip the scales in some instances where RSV continues, where COVID continues and happens to grow. And then the other thing that's at play here, and I mentioned about staffing concerns. Well, we talked about this ad nauseum back in the wintertime about staffing concerns with adult hospitals. And I may be biased because I'm a pediatrician, but you just can't switch around adult caregivers and pediatric caregivers. Likewise, they have different equipment, different medications, different pretty much everything. I think people get into the habit of thinking that kids are just small adults. It's a whole different set of medicine. And so that means we don't have as much flexibility to flex our staff and to pull in additional staffing and to pull all these extra levers like we did back in the winter when we had adult hospitals to fill up. So that's a concern. And I don't want to minimize the capacity issues in adult hospitals right now. We're starting to see that throughout the state. We do have a little bit more leeway to use some of that staffing flexibility, but adult hospital capacity is a concern as well.
Thank you. We will go back to Jessica Jaglois and see if your mic is working. Jessica?
Can you hear me now?
Yes.
Oh, thank goodness. Thank you everyone for checking on me though. Okay, so vaccine uptake has increased in the last 2 weeks, but what evidence shows that the campaign Give It a Shot actually helped prior to the Delta variant seeming to be the impetus behind the increase? And the second part of that question is, what are you hoping to learn by instituting some fall research, similar to the research that was conducted earlier this year?
Yeah, those are actually, I guess my answer would sort of be the same to both of those questions. So our Give It a Shot campaign is a long-term play. It's running May through November. So we're not even quite halfway done with that campaign. You'll notice that compared to some previous campaigns, they're a little less frequent because we're stretching it out longer. So I think it's still too early to talk about the effectiveness. At the end of the day, we've had increased vaccine uptake amongst Tennesseans, and it doesn't matter why that. I don't really care what the reason is. I want our work to be effective, but whatever it is that's causing it, I appreciate that and am encouraged by that. Now, the second round of market research will help us know what are the reasons for hesitancy continuing on, because one of the reasons that we heard early on is it's still too new. I don't really know yet. I want to wait and see what happens. Well, fast forward the tape 6 or 9 months, they may very likely feel differently about that. Likewise, have we seen shifts in hesitancy amongst certain populations? Does the Hispanic population have a different reason now? Or is one of the reasons that the rural conservative population was hesitant, has that gone away? So I'm very interested in that market research, and we're targeting that for early fall.
Next question is to Blake Farmer. Blake?
I've unmuted. I was going to ask this question to Dr. Piercy and try to take the gigantic politics out of it. But if you were in the room with all these school boards who are feeling all this pressure from parents, mask, don't make us wear a mask, and they're just asking you, the pediatrician, what should we do as we have our kids back in school? What do you tell them?
Blake, you said the key word in that question, and that is parents. So I don't think anybody debates the effectiveness of masks. The CDC and the AAP have already come out and very clearly said it. I think the key here is that parents need to weigh into this decision because it is, as you mentioned, a very highly politicized topic. And parents can do that in multiple different ways. First, they can lobby their elected school board, positively or negatively. And you know as well as I do, there are very strongly opinionated parents on both sides of this issue. So they should use that very classic representative form of government, if you will, and talk to their school board representatives and say, this is why I think we should or should not. Likewise, a parent has a choice to make that decision for his or her own child. And so at the end of the day, it's even not a local decision, it's a hyper local decision when you talk about school boards and districts and then specifically the parents. So at the end of the day, this is a parental decision in conjunction with the school board.
And just to make sure I understand what you're saying, you're saying that you would not, I mean, I'm hearing you say that you would not suggest a district-wide mandate, but say that it would just be up to the parents to decide what's best?
As a pediatrician and a mother of four, I will always tell you that parents make the best decisions for their own children. And the other thing is I don't know the dynamics in each of the different counties, but those school boards do. And so if the school boards choose to make that decision, that's their local decision, but it needs to be heavily influenced by the opinion of the parents.
We'll move on to Marta Aldrich. Marta?
Good morning, or good afternoon, actually. I have a question for Commissioner Schwinn first, and then one for Dr. Piercy. Commissioner, you mentioned that you're going to be offering guidance about what information you would like districts to provide and report related to COVID. Can you be a little more specific about what you're going to be asking them to share?
Yeah, thanks, Marta. I can't, because that's going to be an ongoing conversation between the Department of Education and the Department of Health. What we wanted to make sure to do today is to at least forecast that guidance is coming out, make sure that we are able to speak with superintendents, especially as we get into some of the details over the weekend. What we are doing, though, is we will have a call with superintendents on Monday, walk them through what additional information we are asking for, and then certainly make sure that we get that over to you. What I can say, though, is that when we look at last year and some of the data that we did collect, it really had to do with ensuring that families and schools were aware of students who either were COVID positive or close contacts, wanting to make sure that districts have the protocols and information they need to provide that information to families. So we'll have more to come on that, but this is just to kind of provide that preview that we are going to be issuing additional guidance in response to some of the data that Dr. Piercy shared earlier.
Okay, thank you. And Dr. Piercy, on masking, there is a lot of mask confusion now among parents. Do you agree with your boss who doesn't want districts to issue mask mandates? And can you clarify for parents, if the goal is to keep kids learning in person, doesn't masking provide a layer of protection toward accomplishing that? And then I'm just going to also make this point, because I heard what you said about it's parents' decisions, but I've been talking with a lot of parents this week who are going to send their kids to school with masks, and they fully expect in their districts that don't require masks that their kids are going to remove their mask as soon as they get to school. And they're frustrated. And they're looking for some cover, frankly.
Yeah, Marta, I understand all of that, and I hear all of that. And you know, I mean, this is an issue for all of us parents as we send our kids back to school. So masks are an effective tool. They're one tool, and fortunately, we've got an even better tool now. The bad news is not all kids are eligible yet for that really good tool, which is a vaccine. I'm sure you've seen that Swiss cheese model where all of the things line up, and masks are one of those things that help us give an extra layer of protection. So is distancing, so is hand washing. People tend to latch on to one intervention or not. And the fact of the matter is all of those interventions are effective, and some of them have varying levels of effectiveness. And so I don't think anybody questions that masks are an extra layer of protection. And if kids want to wear those to school, then, and the parents have chosen to do that, then those parents should be supported in that decision.
All right, our last question for this afternoon will go to LTestino. Laura, please unmute your mic.
Hey guys, good afternoon. I am calling in from Memphis and wanted to talk a little bit about, we focused a lot this week and will be focused even more next week on how COVID has impacted learning. And, you know, so wanted to talk just a little bit about that and how that correlates to guidance that schools will be issuing. So because of the way that the CDC has issued close contact exceptions for socially distanced, masked K through 12 students, masking in schools will reduce learning disruptions by requiring less mass quarantines of students, likely less potential infection with this Delta variant with schools that are having more students in the classrooms. And so I guess I'm curious, you know, at what point of increased pediatric cases or hospitals that are dealing with too much RSV and COVID on top of each other. Will the department maybe make more strong recommendations for some of these guidances to decrease the disruptions for students in the classroom?
I didn't catch who exactly that question was intended for, but I'll take a stab at it since we're out of time. So the Department of Health has already, we've passed along the CDC guidance, we've passed along the AAP guidance. We don't have anything to add to that. Those two large national bodies have spoken, and we're telling districts and parents, this is your choice. And you've heard me say before, disease spread is not the same all over the state all at the same time. In fact, I just said it earlier today, it's a little more hot and heavy, or quite a bit more hot and heavy in Shelby County and in West Tennessee right now than it is in other parts of the state. So that's why it's so very important that parents weigh into their school boards, and their school boards make those decisions on the local level of what's happening in their communities.
Yeah, I guess you're saying school boards here, we've seen the autonomous Metro Health Department here make that decision. And for the most part, here in Shelby County, we've never had school boards be the authority on that. Does the department feel that the state has that authority, or that the health department has at all overstepped its authority in Shelby County?
I would love to answer your question. I feel like that's a legal question, and I don't want to speak out of turn. It's my understanding that there is legal authority for school boards to make those local decisions. Any legal questions beyond that, I'd have to defer to council.
All right, with that, we will conclude our briefing for today. Thank you everyone for joining us, and have a great Friday.